Speaker. My question is to the Minister for Health and Wellbeing. Can the Minister advise my community and the surrounding locations impacted by the recent diversion of birthing facilities at Jamestown and Crystal Brook being transferred to Port Pirie for 6 weeks from the 15th of June to the 31st of July? And what actual consultation with whom was undertaken prior to the decision being made? And also, will these services be returned to those locations within the 6 weeks? With your leave out of the House, I'll explain further, ma'am.
Leave is sought. Is leave granted?
Thank you. The decision was made to divert the birthing systems to Port Pirie. However, with discussions with various medical qualified people, including GPs, midwives, nurses and others, who have expressed very great concerns that they were not adequately consulted prior to decision being made.
Thank you very much, Speaker, and I thank the member for his question and his interest in this important topic, and I'm happy to provide a bit more information to him and context to the House around the decisions that have been made recently, primarily at 3 locations, Speaker, Crystal Brook, Jamestown and Kapunda, in terms of the birthing services that have been available there, where we have put in place diversions due to workforce shortages. I am aware of the points that are raised by the member in terms of medical professionals who've reached out to him as the local member and have reached out to me as the Minister for Health as well, who were unhappy with the communication and engagement that occurred before the decision. I have asked, and this is, I understand, taken place on a number of occasions already over the last number of days, asked for conversations to occur with those staff to ascertain their views on the diversions that are put in place. I think I'm right in saying that it is less a case of there being a disagreement about whether or not the diversion needed to take place. I understand there was, broadly speaking, agreement about it being the safest course of action to put those diversions in place rather than continue them and not being able to say categorically that they would be safe for women to use, but the point of difference was more around how that engagement and communication occurred between those medical professionals and the local health network primarily, who were making the decision around the diversion. I have met with the Chief Executive and the Chair of the local health network. I have made it very, very clear within the last week that I expect that communication and engagement with those doctors and other staff to be done in a more fulsome and thorough way if this needs to happen again. These are staff who are, of course, critical to our healthcare system in regional parts of the state. They want only the best for patients. They want only the best for South Australians living in regional parts of this state, and they're trying their utmost to make sure that these services, like the birthing ones to which the member refers, are able to continue. I want them to continue as well. That is my expectation. That is my desire. I understand it. At this stage, in terms of Crystal Brook, the diversion is in place until the 31st of July, Jamestown 31st of July. We have not set a date yet for Kapunda, but I also am very keen for that to recommence, and so is the local health network as well. I do not, though, want to set expectations around when these services might recommence that then can't be met, so that there are women in that local area who are due to give birth who, on the understanding of a recommencement date, which might not actually be realistic, then make plans to give birth at a hospital and then at the last minute have to change their plans and go somewhere else if we are not able to deliver on that recommencement date. That's the reason that we're doing that in the case of Kapunda. It's not because we have a secret plan to remove the birthing services permanently. We don't want to do that, but it is, as the member well knows, in his part of the state, often a challenge to find those staff. I am hoping that one of the things, Speaker, that might actually aid us in doing that work is the announcement that was made by the Premier and the Treasurer today around a new enterprise bargaining agreement for nurses and midwives in South Australia, which does also encompass some extra incentives to try to attract, particularly in this case, midwives to areas where we have a shortage. And I hope that will actually strengthen our arm and assist us in being able to do that so we can recommence them. I want South Australians, wherever possible, to be able to give birth locally when it's safe. I've taken on board the feedback of the doctors and other healthcare professionals to whom the member refers, and made it clear to that local health network that we need to do better, and I'm confident that we can in the future, and happy to keep the member up to speed with plans to recommence those services.
The member for Gibson.